Hi, Robin Forster here with Feel So Alive, and I have a special guest today that I want to introduce you to. And her name is Dr. Melanie Carlone, and she has a fascinating background. And so, Melanie, would you like to take it away and tell us how you got to where you are, a little bit about your background, and what is the gift that you can share with the world today to help us all kind of have a more pleasant time of it?
Thank you. Well, first of all, thank you, Robin, for being the holder of this space because I think it's awesome. I think it's really awesome, and I'm honored that you asked me. So I'm a physical therapist with over 30 years work in the field. It's hard to believe. Who got to start doing physical therapy or understanding the human body when I was a Peace Corps volunteer in Central Zaire. And there were Dutch volunteers that couldn't get around. I had a motorcycle, they had bicycles. So they taught me how to look at human movement, how people were walking, to see if they would benefit from orthopedic surgeons that were coming in from Médecins Sans Frontières, doctors who were doing surgeries. And so here I was, this 20-year-old, all of a sudden looking at how people were walking. And of course, there were a lot of orthopedic injuries and stuff. And I started paying attention to that. And then afterwards, after Peace Corps, I traveled for a year. And as life has it, things line up. I met about 15 overseas, they're called physiotherapists. And I'd never met one in my life, and I must have met 15 of them and started to find out more about their work. So when I came back, I started to look at what it would take to be a PT. And I was offered a full scholarship in the U.S. Navy. So I became a naval officer, which wasn't far from my roots. My dad was an Air Force colonel, and he inducted me into the military. He was quite surprised going from the Peace Corps into the Navy, but it was very cool. And I got some of the best training you can get anywhere. So it was there that I started my work, which is, Robin, I do now, which is to work with people's feet and look at how you align ear over shoulder over hip to use your bony structure, your skeleton, the way that it's designed. And when you do that, everything functions better. So that's sort of my wheelhouse. But I've worked in so many different areas of physical therapy, including in the military being trained to do chest physical therapy. So now there are respiratory therapists, but back in the day, physical therapists did all the respiratory therapy before there was respiratory PTs or respiratory therapists. So I am now, especially with this COVID thing going on, really wanting to bring the message to people that, one, pneumonia is not inevitable if you get this. If you do get it, there are things that you can do to get out of it quicker and not have long-term problems. And of course, there's no research specifically on this, but this is common sense at 30 years of work. So the respiratory thing is really important. I'm putting together, I'll actually be doing a 60-minute class on things you can do for yourself and for loved ones if people have compromised respiratory systems at home. And you want to know that stuff because you could potentially go to a hospital right now and be turned away if you're not sick enough. So there are many things you can do to increase your health and wellness, increase the fluidity of the fluid in your lung, the interstitium, the fascia of your body, and overall to increase your optimal health so that you don't get sick. And if you do, you don't get sick really badly. So that's what I'm up to with that.
Whew, that is a lot.
Right? Yeah.
Wow. Yeah, but I know that you have deep dived into so many things. I mean, we should probably tell people that when I first met you, we were both going to a gym with the same trainer, and it was a very small, intimate group. And all of a sudden, you and the trainer would start talking all of this stuff. And I'm real interested in health and wellness. And it was like, what are you talking about? What is that? What muscle? What
Right.
bone? Tell me more about that. And so, and you guys would just almost just do a riff on body parts. And it was amazing. And so, to be able to stay connected with you has just been a delight for me. But I wanted to let people know how I first found you was we're both hot and sweaty, working out, lifting weights.
Right. Yeah, no, it's been awesome. And to keep developing our relationship in different ways has really been great.
Oh, good.
Town,
Yeah.
Eugene is a special place, and there are many extraordinary healers. And I think now more than ever, we need to be interconnecting and creating the web for resilience. This idea of individuation and individualism didn't work in medicine, right? Breaking the body down into specific parts and not seeing the whole human being didn't work. It's not working during this virus thing. It's not, people are really seeing the effect of being isolated and alone. That's not working. Zoom has never been more important. So there's a lot of really great messages in connecting and co-creation. So thank you for that.
Yeah. Well, can you tell us a little bit about the lungs and the breathing? And because I'm finding myself holding my breath. I'm sitting at my desk, there's absolutely no reason, and all of a sudden I realize that either I'm holding my breath or doing really shallow breathing. And I know that part of it is the energy of the world because I can feel the energy, and it's a little sucky right now. And so I don't know if that's a piece of it, but so anything that you can do around breathing to help us all would be fabulous.
Great. So you had asked me to have a tip, and I actually have quite a few. So let me put some things out there and see where things land. People have different needs. So our structure is designed to be ear. If you look from the side, ear over shoulder. You can't see my hip. Ear over shoulder over hip. And when you're standing up, over the arches of your feet. And when you're in that position, the bone above sits on the bone below. Very importantly, your chest is in an open position. And when your chest is in an open position, you're able to breathe and maximize the use of your lungs. Normal breathing, you don't do full deep breathing. But what you want to avoid is what modern living has caused to happen, which is to shorten and narrow in the front, which really increases the likelihood of using muscles in your neck to breathe when you're not designed that way. So two things I would say. One, right now, if you put your hands on your lower ribs, I'm going to shine my camera down here. Okay, hands on your lower ribs, and practice inhaling so you push your hands apart and widen them. This is called three-dimensional breathing. So a big breath. We'll take 3 breaths like that, breathing in, and you should feel the lower back ribs widen and press against the seat that you're on and relax. 3 breaths. So what many of you may notice is that it's hard to do that. It's not easy. And if you're a sitter and you've been sitting at a computer for a long period of time, there's a lot of reasons why we get compressed and shortened. And we tend to think that we need to breathe from our abdomen. And yes, abdominal breathing will deepen your breath. But if you truly want to use the lungs the way they're designed, three-dimensional breathing with the lower back ribs, very important. So there's some positions and there's some postures that you can do to open up the body and make that easy. And I'll be discussing more of that in the class that I do. So that's a really important first step, is lower rib breathing. The second one is if you have any kind of respiratory issue or you start to feel sick, you want to open your chest. And unfortunately, what a lot of people do is they get in a bed and they prop themselves up with pillows. So you end up folding in the front of the chest and not able to excurse fully. And I see this over and again in hospitals when people are in, even the ICU, where they're not being positioned properly, which is to have their ear over their shoulder, over their hip, and bend forward at the waist, not propping the body up and collapsing at the chest. So that is very important. If you're having any kind of respiratory issue, open your chest. You can even put a pillow behind the chest and let the head draw back a little bit and support the neck so you don't kink your neck. That can make a very big difference in bringing in full breaths. So we talked about lower rib breathing and maximizing what's called the full tidal volume of the lungs, opening the chest. And the third one is an exercise I want you to practice. Now, I want to explain it first because if you're not used to doing this, and if you're a neck breather, this can be very challenging. So take it easy. If this isn't comfortable, stop. Do not do this if it's not comfortable, because this is truly to be under the direction of a physical therapist. Use your common sense. Okay, so first thing to do is put your hands on the side of your neck, not on the carotids, which are forward, but on the deep side of the neck. And I want you to take a deep breath. Put your hands back just a little bit further, Robin. There you go. I want you to take a deep breath now, filling your lungs, but try not to make any action under your fingers. Try not to use those muscles. So go ahead now, breathing lower back ribs. And you're going to feel when you come to the very top, those muscles engage. And now let it go. And now once again, take a deep, slow breath and see how long you can go without using your neck muscles at all. With normal breathing, it should only be at the very, very top that the neck muscles kick in. If you're kicking in your neck muscles early, you are using your scalenes to breathe, and we're not designed that way. A couple of things. Breathe with your scalenes, you start to activate the autonomic nervous system that tells you there's a danger. And so it increases all kinds of cortisol in your body. It puts you on alert. And that's where holding the breath can come from. Okay? So this one's for you, Robin. So here's the exercise. I'm going to have you lower rib breathe. You're going to sit back in your chair, bottom all the way back supporting you. lower rib, middle, upper chest, full as you can. And then you're going to take an extra sip, full, full, full. And then holding that 3 to 5 times, you're going to turn your head first to the left with a very full neck. Keep holding the breath. You're retaining 3 to 5 times, turning to the left, coming back to the center each time, and then to the right. Slow, no pain, but feel the full range of motion as you're holding your breath, holding. If you need more, you can sip in a little more. 3 to 5 times, come back to center, let all the air out, and just leave it out and hold it for a minute until it feels like you need to take a breath.
That was wonderful.
And one of the things I should have said is do a body assessment first. And you're going to find when you're breath holding or you're feeling anxious, you're feeling pressured, your autonomic nervous system's kicking in, so you have more sympathetic activity, which makes you anxious. Doing this breath can have a profound effect, just one round of it. If you do 3 rounds of it, you will absolutely notice you're also changing the pH of your blood. All of that works together to calm the body.
Nice. Wow. Well, thank you, Dr. Melanie Carlone. I want to get this correct with Align, Renew, Thrive Physical Therapy. Mm-hmm. And I appreciate you doing this and giving us your time. And that just was awesome.
Oh, I'm so glad, Robin. So alignrenewthrive.com, you'll get to hear about my upcoming class, which will be probably next Monday, if you want to participate live. And I really am grateful for this opportunity. Thank you.
Oh, well, thank you.